Oh, hey there, this is Dr. Evan Osar, just working on some of my rehab exercises. I was recently asked to consult with a good friend of mine who had some shoulder pain following some rehab exercises she was doing, recommended by her physical therapist for her elbow. She was having some lateral epicondylitis, and so pain on the outside of her elbow, and she was given these exercises. Hello, my fellow friend, my good friend Pete Rizzle from the East Coast. She was given this exercise with some band external rotations for her lateral epicondylitis. Very common exercise for people that have shoulder issues, neck issues, as well as elbow pain. Now, traditionally, that's a good exercise unless you are an individual that has a labral tear in the shoulder, so the labrum that goes around the glenoid fossa that helps to suction cup the humeral head or the ball into the socket. And she's one of those individuals. I'm one of those individuals. So when we perform, individuals like us perform external rotation, especially too many repetitions or with too high a resistance, then we start to create tightness in the back of the shoulder, especially those external rotators of the shoulder. Let me show you how quickly you can actually mess somebody's shoulder up with the wrong rehab exercises. I'm going to check my shoulder flexion. And this is my uncompensated shoulder flexion on my worst side. So I have about, just say, generously speaking, 165 degrees, okay? Now, obviously I can compensate with my back and get it up to 180, but that's not really 180, it's just because I'm doing back extension. So I have about 165. Now I'm gonna take a band. I'm gonna do, this is the lightest, almost the lightest band you can get. So again, really light resistance, we're gonna do some external rotation work. And again, this is a very common exercise. It's a very common corrective exercise before people train. So we see the people doing this all day long. Lots of external rotation, retraction, depression, all that good stuff that we get taught from Rehab 101. So again, I've done maybe about 10 repetitions, very light, easy resistance. Now let's recheck my range of motion. And again, with about 10 repetitions, I've lost easily 10 degrees, and it feels awful for me to do that motion now. So again, this is what happens when you have an unstable shoulder and you hyper-focus on external rotators. So muscles like the posterior deltoid, the infraspinatus, the teres minor, and even that teres major gets involved even though it's an internal rotator because it's underneath here. So as you're externally rotating, even though it's not technically contributing to the motion, the retraction or the pulling down of the shoulder in that position will also make teres major tight. So you start to get restriction of the shoulder, the humeral head starts actually becoming too compressed into the glenoid fossa or the socket and or starts to travel forward. So here's something you can do to help those individuals maintain, or I should say achieve more range of motion and or maintain it once they've achieved it. Now, we would always use our roga. So we take a roga. I would do this on the floor, but we'll just do it against the wall. First, I want to release the backside of the shoulder. So I want to get up underneath the shoulder here where those external rotators live, where teres major lives. I'm going to put some pressure there. You can use a lacrosse ball as well. We just like the roga because it works. And again, I would be on the floor. I'll just do it on the wall for purposes of this video. Now from here, after I've done a few minutes of myofascial release, maybe 90 seconds to 2 minutes, I'm going to do just some reaches. So I'm going to breathe in and then reach. I'll reach out this direction to, again, lengthen those structures in the back of the shoulder. So I want to lengthen, now that I've myofascial released it, make sure I pin the scapular up against the rib cage and then just lengthen. So again, do about 10 repetitions there as well. Now, when I teach my client to start to use their rotator cuff, because again, we need to strengthen the rotator cuff in many of these individuals, especially if you have a labral tear and or you're working with clients with labral tears. Now, one of the patterns we use, I would generally use a loop band, the lightest loop band that we have, which is also the yellow band. But if we don't, just take a band like this. You can even use a towel. So the towel, we'll just take this towel or this band in this case, pull it apart lightly. Again, don't try to crush it. What we want to do is teach our clients how to get more width through the shoulder to help to center the ball in the socket or center the humeral head more appropriately on the glenoid fossa. We also want to create width through the front of the shoulder because, again, many of these clients that have shoulder issues, chronic shoulder issues, they've done so much to pull or spent so much time pulling the shoulder into the socket to make it more stable. We want to teach them how to create space between the humerus and the body, or the upper arm and the body. Grab a band or the towel, pull it apart gently. Again, just towel pull aparts, band pull aparts. The goal is not to crush this. It's to help activate the rotator cuff muscles, help to position the shoulder in a better position. And now we just do our breathe in, breathe out, bring the arms up. And again, we're trying to keep the forearms parallel to each other and perpendicular to the floor. So from the side, breathing in, breathing out. And again, the goal is to keep space underneath here to lengthen as I go up overhead. And again, we can do this in lying position. You can put the back to the wall. Have your client put their back to the wall, and now you're getting some kinesthetic feedback from the wall. Again, they're working on keeping their shoulders open and wide. So again, we're getting good postural training of the extensor muscles without hyperextending through the thorax and or lumbar spine. So again, about 10 repetitions of those. Now I'll recheck my range of motion. Again, remember, we did maybe 30 seconds of myofascial release. We did maybe 1 minute, if that, maybe 30 seconds of band pull aparts. And now I'll recheck my range of motion, much better, and actually better than it was prior to me starting. So it's not about teaching your client to do all this crazy mobility work. It's not about teaching them to do 20 minutes of myofascial release work. It's not about trying to strengthen every muscle around the rotator cuff. It's understanding where you want the shoulder to be positioned, what is actually limiting your client. Do they have a labral tear, a rotator cuff tear? Do they have a habitual pattern of gripping and pulling that shoulder into their body? Are they able to create external and internal rotations so they can get the appropriate motion between the ball and socket joints? And then are you training in a way that reinforces optimal movement? And that's what we do in 2 Anatomy Geeks, the rotator cuff series. We talk about the anatomy of the rotator cuff so that you understand how the shoulder functions and how the rotator cuff muscles help to provide stability to the shoulder. More importantly, or I should say as importantly, we help you apply this information because, yeah, it's great to have knowledge. It's great to impress your friends with all your anatomy knowledge at your upcoming holiday parties. However, it's obviously important that you instill this information, you break it down, you make it simple for your clients to understand so you can actually use the information so they can understand it and you can help them navigate and choose the best exercises and approach that work for them. So this is just one strategy we share with you in this video series. We, again, take you through, when I say we, my fellow anatomy geek Jill and I take you through the functional anatomy of the shoulder complex, how it works, how it functions, what commonly goes wrong, and then we teach you the most effective assessments, corrective exercise strategies, and how to integrate this into fundamental movement patterns so you're helping your clients engrain, I should say, and incorporate this information into their central nervous system so they can use this during their everyday life, during their exercise, and help to develop more stable and more mobile shoulders in the process, and help so many clients that have chronic shoulder and upper back issues, because a lot of clients with shoulder issues also have upper back and or neck issues, and they sort of feed upon each other. So you'll help a lot of clients with chronic issues. If you're looking for more information, I'll put the link next to this video. Check it out, 2 Anatomy Geeks, Anatomy of the Rotator Cuff. Make it a great day. This is Dr. Evan Osar with Integrative Movement Insider. We'll see you next time. If you have any questions, post them next to this video and I'll be sure to answer them. And keep helping your clients understand functional anatomy, make it simple for them, apply it to what they need to and or want to do, incorporate it into the functional patterns, the pushing and pulling patterns that will help them function in everyday life. And we'll see you next time here at Integrative Movement Institute. Take care. Have a great day. Have a great day, Pete.